Most people think multiple sclerosis only affects movement, balance, or vision, but one of the most personal and emotionally challenging areas impacted by MS is the reproductive system. Multiple sclerosis, or MS, is a chronic autoimmune disease in which the immune system attacks the protective covering of nerve fibers in the brain and spinal cord. Because the nervous system controls sexual function, hormonal signaling, sensation, bladder control, and many aspects of reproductive health, neurological damage caused by MS can significantly affect intimacy, fertility, pregnancy, and sexual well-being. These issues are often under-discussed, even though they can strongly impact relationships, emotional health, confidence, and overall quality of life. Reproductive problems in MS are usually caused by a combination of neurological damage, hormonal changes, fatigue, medications, psychological stress, and physical disability. Understanding these effects is important because reproductive health is a major part of both physical and emotional wellness. One of the most common reproductive-related concerns in MS is sexual dysfunction. In men, MS may cause erectile dysfunction, reduced libido, difficulty achieving orgasm, or problems with ejaculation. These symptoms occur because nerve damage interferes with communication between the brain, spinal cord, and reproductive organs. In women, symptoms may include vaginal dryness, decreased sensation, pain during intercourse, reduced sexual desire, or difficulty reaching orgasm. Fatigue, muscle weakness, bladder dysfunction, spasticity, and emotional stress can make intimacy even more difficult. Some patients may avoid sexual activity because they fear embarrassment, incontinence, or worsening symptoms. Sexual dysfunction in MS is extremely common, yet many patients hesitate to discuss it with healthcare providers due to discomfort or stigma. However, proper communication and medical support can help improve intimacy and quality of life significantly. Hormonal function can also be affected in individuals with multiple sclerosis. The brain plays a central role in regulating hormones through the hypothalamus and pituitary gland, and MS lesions may disrupt these pathways. Women with MS may experience changes in menstrual cycles, worsening symptoms during menstruation, or hormonal fluctuations that influence fatigue and mood. Some women notice temporary worsening of neurological symptoms before or during their periods due to hormonal shifts. Men with MS may develop lower testosterone levels, which can contribute to fatigue, depression, reduced muscle strength, and decreased sexual desire. Hormonal imbalance may also worsen emotional symptoms such as anxiety, irritability, and mood instability. Because hormones influence both immune activity and nervous system function, researchers continue studying the relationship between hormonal regulation and MS disease progression. Pregnancy is another major topic when discussing the reproductive system and MS. Many women diagnosed with MS worry about whether they can safely become pregnant or whether pregnancy will worsen the disease. Research has shown that pregnancy itself does not usually accelerate long-term disease progression. In fact, during pregnancy, especially in the second and third trimesters, relapse rates often decrease because the immune system naturally becomes less inflammatory to protect the developing baby. However, the risk of relapse may temporarily increase after delivery, particularly during the first few months postpartum. Fatigue and physical stress after childbirth can also make symptom management more difficult. Women with MS often require careful planning before pregnancy because certain disease-modifying medications may not be safe during pregnancy or breastfeeding. Neurologists and obstetric specialists typically work together to create safe treatment plans before conception and after delivery. Fertility itself is generally not directly reduced by multiple sclerosis, but the disease can indirectly affect reproductive decisions and family planning. Fatigue, disability progression, depression, financial concerns, and fear about future caregiving responsibilities may influence whether patients choose to have children. In men, sexual dysfunction and ejaculation problems can sometimes affect fertility potential. Certain medications used to manage MS symptoms may also impact reproductive health or pregnancy safety. Emotional stress and relationship difficulties associated with chronic illness can further affect family planning decisions. Genetic concerns are another important issue for some families. Although MS is not directly inherited in a predictable way like some genetic diseases, having a close relative with MS may slightly increase the risk for future generations. Genetic counseling and proper education can help families better understand these risks and make informed decisions. Bladder and bowel dysfunction also play a major role in reproductive and sexual health in MS patients. Damage to nerve pathways controlling the bladder may cause urinary urgency, frequency, retention, or incontinence. These symptoms can create anxiety and embarrassment during intimacy, causing many patients to avoid sexual relationships altogether. Bowel dysfunction, including constipation or loss of bowel control, may further affect confidence and emotional well-being. Physical symptoms such as muscle spasms, tremors, weakness, pain, and mobility limitations can also interfere with comfort during sexual activity. Addressing these symptoms through rehabilitation, medication adjustments, pelvic floor therapy, and proper symptom management may significantly improve intimacy and self-esteem. Open communication between partners is extremely important for maintaining emotional closeness and reducing misunderstandings related to physical limitations caused by MS. Psychological and emotional health are deeply connected to reproductive function in multiple sclerosis. Living with a chronic neurological disease can lead to anxiety, depression, body image concerns, fear of rejection, and reduced self-confidence. Patients may struggle with feelings of guilt, frustration, or fear about how the disease affects their relationships and future plans. Emotional stress itself can worsen fatigue and other MS symptoms, creating additional challenges. Counseling, support groups, and mental health care can help patients and partners cope with emotional difficulties related to sexuality and reproductive health. Education is also essential because many reproductive symptoms can improve with treatment and supportive care. Healthcare providers should encourage open conversations about sexual and reproductive concerns rather than focusing only on neurological symptoms. Management of reproductive system dysfunction in multiple sclerosis requires a comprehensive and individualized approach. Treatment may include medications for sexual dysfunction, hormonal therapy, counseling, pelvic floor rehabilitation, fatigue management, and adjustment of disease. Modifying therapies during pregnancy planning. Physical therapy and exercise may improve strength, mobility, circulation, and overall well-being, while stress reduction strategies can support emotional health. Regular communication with neurologists, gynecologists, urologists, fertility specialists, and mental health professionals helps ensure safe and effective care. Ultimately, reproductive health in MS involves far more than fertility alone. It includes intimacy, hormonal balance, emotional connection, family planning, pregnancy management, and overall quality of life. Although MS can create significant reproductive and sexual challenges, proper medical care, emotional support, and open communication can help patients maintain healthy relationships, confidence, and a fulfilling personal life throughout the course of the disease.